Hi, everyone. It's a privilege to share my latest work on the potential target spot for the curation of pancreatic cancer. And as you can see, our topic is about new frontier in cancer treatment, targeted therapy of metabolic key enzymes. According to the statistic accessible to us by now, cancer has a 5-year survival rate of less than 10%. Chemotherapy resistance and lack of targeted spots are the main bottlenecks of its curation. Today, I will share how to break this deadlock by targeting the key lipid metabolism enzymes, ACC and FASN. And before we go to the main part of the today's topic, inhibitor, we have to talk about the basic information of the background, especially the pancreatic cancer itself and how it just developed today. We got two pictures here. Of them is pie chart. The first one is the stage distribution of the patients, and we can find out that most of them is in the middle or the late stage of the disease, and it meaning that it's hard for them to cure it. And so it results in the next picture, we can see the death rate. Death rate is quite high. More than a half of patients will die from this disease, dying this disease. So there are still more things we should do to stop it from developing and find a way to cure it. And then we come to the problem found part. It's about how we, target these two kinds of enzymes and what may influence the develop of, the pancreatic cancer. As we know, there are a lot of work being done on information of searching for the key factor that may lead to the pancreatic cancer. And one of the discovery is gene KRAS. The picture C comprehensively displays multidimensional information such as CNV, mutation status, and tumor characteristics of multiple genes, while picture D focuses on the KRAS gene and conducts specific and tumor characteristics of multiple genes. Okay, sorry. I've just got the wrong, information. We can see that. Let's get back to the D here. The D focus on the KRAS genes and conducts specific sequence testing to obtain the frequency of different types of gene mutations. This reveals the close relationship between KRAS genes mutations and occurrence of pancreatic cancer, providing support for research directions. KRAS is a key gene which can produce a kind of protein modulating the proliferation and growth of cells in the human body. The mutation happens, cancer occurs. That's simple, right? And the next reason is the SPEBP1 path. Sorry, SREBP1. I got the wrong things here. And we can know from the illustration in PPT here, it is the SREBP1 that activates the expression of FASN. And also the procedure after this, after this step. And after reviewing a lot of literature and materials, we can find out easily that both possible factors related to lipid catabolism, meaning cancer may be controlled and treated by inhibiting the protein in this progress and generated by the gene mutation. So we start to work on lipid catabolism and try to find a way to cure it. And here's the two kinds of enzyme we find here. Both of them is the key enzyme in the lipid metabolism. And ACC is called acetyl-CoA carboxylase. It can catalyze generation of malonyl-CoA from acetyl-CoA. And FASN, called fatty acid synthesis, produce fatty acid with malonyl-CoA and acetyl-CoA. They're quite simple in this progress, and also we can see that in cancer cells, due to the Warburg effect, sufficient acetyl-CoA can be provided under low oxygen conditions, and ACC can convert it into acetyl-CoA, supporting FASN-driven fatty acid synthesis. SPEBP1 is a transcription driver that is also overexpressed in cancer cell. As we can see in the later this picture, yeah, and it can help us to identify two key lipid metabolism enzymes. It's in the FASN. In two cancers, the SPBP1 ACC FASN axis is abnormally overexpressed, promoting lipid accumulation and proliferation. And so, how can we, after we know the target points we got here, we have to talk about the inhibitor of it. It's how we cure it, how we think we can cure this disease by using these ways. And first of all, we're going to introduce the inhibitor of ACC. The first type is and the TUFA is one of the inhibitor of ACC we're going to talk about. It is a classic allosteric inhibitor of acetyl-CoA carboxylase. Exerts anti-tumor effects by blocking the rate-limiting steps of de novo synthesis of fatty acid. The mechanism is manifested as triple metabolic interference. We can see from here. The first one is it can reducing the level of acetyl-CoA, directly inhibiting the synthesis of long-chain fatty acid, mediated by fatty acid synthesis and disrupting membrane lipid homeostasis. The second one that they can accumulate the accumulated acetyl-CoA activates pyruvate carboxylase, promotes the tricarboxylic acid cycle replenishment, and leads to energy metabolism imbalance. And otherwise, it will reduce NADPH supply, making nucleotide synthesis and antioxidant defense. Synergistically enhance DNA damage sensitivity. And preclinical studies have confirmed that TUFA can inhibit more than 8% fatty acid synthesis and induce apoptosis in breast cancer model, inhibit DNA repair in glioblastoma in cooperation with radiotherapy, and reverse SREBP1 FASN signal-driven tumor progression in obesity-related liver cancer. Although TUFA is a key tool for studying the function of ACC-FASN axis in cancer, inflammation, and metabolic disease, its clinical application is limited by off-target efforts, low oral bioavailable, and high-dose liver toxicity. And here's some pictures about how it proved the effects of it to stop the cancer cell from growing through inhibit the work of ACC. And the first one is the renal cell carcinoma. It's not about pancreatic cancer, but it shows the potential of these kind of enzyme, which can be used to prevent the development of the cancer. So some other researchers made some research into how it works in the pancreatic cancer. And here it goes. And the experiment results show that TUFA has excellent inhibitory effect on cancer cell growth. It can be found obvious, right? When more TUFA is put into the experiment, the better it can inhibit the growth of different kinds of pancreatic cancer. And then we're going to talk about the next one. It's the ND600. ND600 ND64, ND6, sorry, there's another fault here. And then here comes to our next inhibitor of ACC, ND646, yeah, 646. And it has been validated, and the picture we got here, it's the ND646 and its derivative, derivative, derivatives. Sorry, yeah, it is of them. And according to the some researchers, it has been validated in numerous cancer cells, confirming its inhibitory effect on ACC and achieving anti-tumor goals. And the compound has a certain targeting ability, which can reduce the harm of common chemical drugs. ND646 is highly efficient and selective acetyl-CoA carboxylase allosteric inhibitor that provides a new strategy for cancer treatment by targeting key rate-limiting steps in lipid metabolism. The drug simultaneously inhibits the ACC1 and ACC2 subtypes, blocking the de novo synthesis of fatty acid at the molecule level. This dual effect disrupts the lipid homeostasis of cancer cells, inhibiting their proliferation and survival ability. Preclinical studies have confirmed that in non-small cell lung cancer, acnograft models, ND646 monotherapy can significantly inhibit tumor growth by over 70% and shows a synergistic effect when combined with EGFR inhibitors, especially effective for EGFR TKI resistant tumors. Its mechanism can be related to reversing metabolic compensation pathways, and therefore is also expected to show efficacy in pancreatic cancer. It is worth noting that ND646 inhibits highly selective inhibitory effects against ACC, stabilizing the inactive polymer state by binding to the BC domain of ACC. Compared to the TOFA we just talked about, it shows a better safety profile, and no significant liver kidney damage was observed in preclinical toxicity evaluations. At present, the drug has complete pharmacological validation and is undergoing phase 2 clinical trials, focusing on exploring its potential as a monotherapy and in combination with immune checkpoint inhibitors for the treatment of solid tumor. As a representative drug targeting metabolic checkpoints, ND646 is expected to overcome traditional therapy resistance, and the identification biomarkers for predicting its efficacy will be a key direction for future translation research. And that's all of the ACC inhibitor of ACC, and the finally come to the inhibitor of FASN. There will be also two of them, orlistat and gemcitabine. Orlistat is mostly known as a weight-reducing aid. Here, you may very familiar with them, and it is used to the weight-reducing aid, of course. However, since it can inhibit FASN, it shows great potential fighting against cancer. So we got it here and try to find out whether it can inhibit the growth of cancer cell. And gemcitabine is, the pancreatic adenocarcinoma is moderately responsive to gemcitabine-based chemotherapy, and it is the most widely used single-agent therapy for pancreatic cancer. And most of the cancer cells have owned resistance to this drug, however. But with the help of orlistate, there will be an unbelievable effect on treating cancer. The orlistate nanoformulation disrupts tumor lipid metabolism by targeting fatty acid synthesis inhibition, reducing membrane repair capacity and downregulating P-glycoprotein to reverse drug resistance. And gemcitabine induces genotoxicity by interfering with DNA synthesis. Their synergy creates a dual metabolic genotoxic strike. Orlistate potentiates gemcitabine's DNA damaging effects and co-activates in endoplasmic reticulum mitochondria apoptosis pathways and remodels the immunosuppressive microenvironment. This strategy provides high efficacy combination therapy for pancreatic cancer and triple negative breast cancer. Through the application of the above inhibitors, and that's all for today's work. And let's see the effective it shows in some research and some literature we found. And here it is. And we can find it clearly that it is a quite strong improvement for the cooperation effect. And here we go. You can find it out easily. Yeah. And that's all for of today's inhibitors we're gonna talk about. And through the application of the above inhibitors, we can partially overcome the problem of chemotherapy resistance in cancer cells and have the potential to target the tumor microenvironment. However, we still face the issue of inhibitor delivery efficiency, and only by solving these problems can we better apply them to clinical practice. In the future, we can further investigate the possibility of ACC and FASN dual target inhibitors, or combine them with immunotherapy for more efficient treatment. And that's all for today's presentations, and that's the reference of today's topic. And it's almost mostly the where the pictures we got from. And thank you for listening. And that's all for today's topic. And thank you for listening. Thank you so much. Here we go.